This pandemic continues to challenge the global community. It continues to challenge us as a nation, and it challenges us as individuals. Can I say that Australians have shown themselves to be the resilient, courageous, determined people that all of us in this chamber know that Australians are. They've followed instructions under hard conditions, particularly the conditions that Victorians are experiencing at the moment. And I say that we are indeed all in this together. Australians are certainly doing their bit, and I have never been as proud to be an Australian as I have been through this difficult time. The job of an opposition leader and an opposition at times like this is to be constructive, just as it should have been the job of the opposition during the global financial crisis. We have been constructive. We have put forward ideas in good faith and encouraged the government to get on board with those ideas. Where we think the government has got it right, we have said so and praised the government for doing so. But it's also the job of the opposition to call things as they see it in a democracy. It's the job of the opposition to hold a government to account, to make sure that each and every day the outcome is as good as it can be. To do otherwise is not to be responsible. To do otherwise is to abandon the democratic principles that are the fundamental difference between us and other regimes around the world. And there are no areas that have been as critical for this than the area of aged care. The fact is that whilst throughout the country there are some 517 people, at least, who have lost loved ones during the crisis, there's been some 328 of them were aged care residents, and another 7 were in supporting home care. Every one of those Australians is valued. It's a source of heartache. My sincere condolences to all of the families and friends of those who've lost loved ones during this pandemic. Too many of them have had to farewell those loved ones over FaceTime. Too many aged care workers have had to hold the hands of older Australians as they pass. Older Australians who've helped make this great country what it is today. Older Australians who are deserving of our respect and our support. Older Australians who are entitled to dignity in their later years. Aged care residents are vulnerable. They depend on the dedicated nurses, carers and staff in facilities. And I pay tribute to every one of those workers, putting themselves at risk in order to provide support to these vulnerable Australians. They also depend upon the federal government, because it's the federal government that funds and regulates these facilities. And indeed, the Prime Minister told us so. On the 27th of February, after question time was over, after a parliamentary week, on a Thursday afternoon in the Prime Minister's courtyard, where the document was waved around that said this: the Australian government will also be responsible for residential aged care facilities. They were responsible for establishing and maintaining, I quote, infection control guidelines, healthcare safety and quality standards. But what we know was that no plan was put in place. We know this from the Royal Commission Commission opening statement by the counsel assisting, who said this: "The evidence will reveal that neither the Commonwealth Government of Health nor the aged care regulator developed a COVID-19 plan specifically for the aged care sector." The fact is that there wasn't a plan, and there wasn't the action that was required. And if actions speak louder than words, then the Morrison government truly is the quiet Australian. The fact is that this could also have been foreseen, because we know from the statements the Prime Minister said on the 29th of July, "The complete withdrawal of the workforce was," and I quote, "a new situation that had not been anticipated or foreshadowed at a state level or considered at a federal level." But in fact, a document issued by the Federal Health Department to providers on the 29th of June urges providers to, quote, "keep in mind up to 80 to 100% of the workforce may need to isolate in a major outbreak. There may be difficulty recruiting agency staff during an outbreak." But it wasn't just something predicting forward, because we know that it had happened. We know that it had happened. We know that going back to November last year, the Royal Commission released its interim report. Now, the hint is in the title. It's called Neglect. That's the title of an interim report of a Royal Commission established by this government. Neglect. It described the system as following: cruel and harmful, shocking, all too often unsafe and seemingly uncaring. It found that up to half of residents were malnourished. They were literally starving. Here, in a wealthy country like ours, almost half of aged care residents literally starving, found by the Royal Commission. It found too few aged care workers, paid too little. But we know also that that flowed through to what happens, tragically. At the Dorothy Henderson Lodge, 6 residents died. The report was given to the government in April. It only was made public because of the Royal Commission. It found issues with workforce. It found the problems that were there, consistent with the interim report of the Royal Commission. Then there was the Newmarch House report, 17 deaths attributed directly to COVID. It found serious PPE shortages contributed to the outbreaks. We've heard stories firsthand of nurses and aged care workers having to use just one glove rather than 2. How do you lift a resident with one glove? The sort of pressure that these people were on. It found communications failures. This is back in March and April in New South Wales. Warning bells were ringing, but no one was listening. And on June 10, there was a phone hookup with 120 people on the call, including the regulator. People speaking up, crying out for support that's outlined in such detail in the Saturday paper of last week. But for this government, the buck never stops. No one's responsible. No one's responsible. The motto that was used last year, "I don't hold a hose, mate," is a flexible one for all occasions, but very clear for this Prime Minister. This Prime Minister and this government is responsible for aged care. Very clearly, very clearly. But on the 19th of August, the Prime Minister said, "We regulate aged care, but when there is a public health pandemic, then they are the things that are managed from Victoria." In the same statement, he says, when there's a public health pandemic, then public health which, whether it gets into aged care, shopping centres, schools or anywhere else, then they are things that are matters for Victoria. But there's a big difference in aged care and shopping centres. No one's arguing that shopping centres are responsible, that there's a federal regulator, that it's federally funded, but aged care is, and that's why there needs to be responsibility. And it took until today, believe it or not, there was a media release established as a result of a decision just last Friday to finally set up an aged care advisory group. That's a positive thing, but why did it take until now? And just today, the Royal Commissioners themselves, not a lawyer appearing before the Royal Commission, not a submission to the Royal Commission, the Royal Commissioners themselves said this: had the Australian Government acted upon previous reviews of aged care, the persistent problems in aged care would have been known much earlier and the suffering of many people could have been avoided. There it is, the Royal Commissioners. And last Friday we saw, frankly, a minister appear before the COVID-19 committee who's just not up to this task. Just not up to it. I don't know what it takes to lose your job on the front bench of this government. Whether it's, the Minister for so-called emissions reductions, one of the great ironical titles of modern politics, whether it be the Assistant Treasurer or the Minister for Aged Care, there is nothing that any minister can do which is a dismissible offence.
No accountability. It can be a bloke.
And I would have thought that last Friday's performance just underlined that. So we are concerned, and it's legitimate, and we have a responsibility to raise these issues, and we will be raising them in this parliament as it should be this week. We'll also continue to be constructive about a range of issues. We put forward arguments. Can you withdraw? Can I ask that be withdrawn?
I didn't hear what was said, but if a member or a minister made an unparliamentary remark, I'd like them to withdraw. You'll need to come to the dispatch box, that's all. Hansard needs to record it.
I withdraw.
Thanks, Mr Speaker. The fact is that we have put forward a range of ideas on the need for borders to be shut, not just to China, that eventually was adopted. We put forward issues about entry points and temperature testing, quarantining at airports for people who are arriving, that eventually some of that was adopted. We put forward extension and support to youth allowance, Austudy, that was adopted. We put forward wage subsidies that became JobKeeper, originally opposed but adopted. We put forward the need to support particular sectors such as the arts, eventually adopted. We put forward the warning very clearly that snapback in September would not work. The reason why we have to have legislation is because the government told us and the Australian people that all support could be withdrawn in September. We warned about the abuse of the superannuation scheme, and we now know that there hasn't been a single cheque, but $40 billion has been withdrawn on that basis. We put forward the need to support public and social housing and to have job creation, not just the so-called home builder scheme. Above all, throughout this, we put forward a strong view that we needed to listen to the science. That's consistent with our view on other issues as well. We need to listen to the science and listen to the experts and follow that advice, and we'll continue to do so. We'll continue to put forward suggestions to the government. We are concerned about the early withdrawal of support, that it will result in a longer and deeper recession than there needs to be. We will continue to argue for support for measures such as job creation in social housing and other areas. We will continue to argue that during the pandemic no one should be left behind, and during the recovery no one should be held back. That's our firm view. That's our firm view. We will hold the government to account over this fortnight. It is a good thing that Parliament has now resumed. It's a good thing, and I thank you, Mr Speaker, and the President of the Senate for the foresight that you've shown in supporting the measures which are flexible, which will enable there to be parliamentary sittings during this fortnight. That's our responsibility, because we have a responsibility to the Australian people to try to be as determined, to end where I finish, as determined, as courageous, as committed as they are. They have shown that commitment. They deserve nothing less than us doing our absolute best to make sure that the deliberations of the parliament this fortnight produce outcomes that improve health outcomes, but also alleviate some of the economic consequences of the necessary health action which has been taken.